everybody. My name is Shayla Clinton, and I will be doing a presentation on antibiotic stewardship. What are antibiotics? Antibiotics are treat infection caused by bacteria such as staph, strep, or E. coli. And it either kills the bacteria, the antibiotic does, or it keeps it from reproducing and growing. Antibiotics do not work against any viral infections such as colds or flus. Sir Alexander Fleming, a Scottish biologist, defined new horizons for modern antibiotics with his discovery of enzyme lysosome and an antibiotic substance penicillin. So that who is responsible for finding penicillin. 6 years later, as a result of some intelligent serendipity, he stumbled on discovering penicillin. Stewardship. What is stewardship? Stewardship is the job of supervisor of taking care of something, such as an organization or a property. It also is an ethic that embodies the responsible planning and management of resources, such as what we're going to talk about now, keeping the antibiotic from being resistant. Classification of antibiotics. Antibiotics can be classified by the mechanism, indication, and generation. Some antibiotic has different generations, like first generation, second generation, third generation, so forth on. Some antibiotics are grouped by cell wall synthesis, protein synthesis inhibitors, DNA and RNA synthesis inhibitors. Also, we're aware of that in biology. Penicillins are some of antibiotics. Penicillin, cephalosporin, which is rocephin that you get that stings a lot when you can have a cold, and they give you an injection with that. Fluoroquinolones, which is Levaquin, they give that. Aminoglycoside, gentamicin, they can come in the eye drop as well as pills. Carbapenem is Invance, they use that IV. And Microlids, was it Zitromax, are some classification of antibiotics. This is a chart basically showing the total number of new antibacterial agents that has been founded. Antibiotic development has decreased by over half dating from the 1980s to the present, which is, as you can see, in the 1980s, it got up to 16. And as time went on, now in the 2000 to 2012, it is 2. When to use antibiotics? Antibiotic doses may need to be adjusted based upon the patient's age. So when they're older, some people, kidneys, if they become older, the kidney has a decrease in function. Kidney or liver disease, such as if they're on a dialysis machine, or if their kidneys cannot filter anything, or liver disease, such as cirrhosis, therefore that the antibiotics are not being metabolized the way that there should be. And they can become toxic. And in pregnant or breastfeeding women, you don't want that to cross the placenta. Some common infections treated with antibiotics are upper respiratory tract infection, acne, conjunctivitis, STDs, skin infection, tooth infection. And many of us go to the dentist for the tooth infection, and they give us antibiotics before they can do any kind of surgery. Urinary tract infection. See a lot of older people come in with that. And strep throat. When not to use antibiotics. So when you go to the doctor, this is when you don't want to use antibiotics, and you should become aware. And that's the whole theme of this presentation. So whenever you go to the doctor and they want to administer or write you for an antibiotic, and you come in with a sore throat, coughs and colds and flus, you don't need antibiotics. So therefore, you are building up a resistance for it. Those coughs, colds, and flus are viral. That means it's not bacteria. You don't need any antibiotics to kill it. And they do not need antibiotics. During viral infections such as colds and flus, our body immune system fights that infection, which causes us not to need antibiotics. Using antibiotics for viral infection can increase the risk of antibiotic resistance, lower the option for future treatment. So therefore, if you build up a resistance against that antibiotic, later on when you need it, they won't be able to use it on you because you have built up the resistance and it's not going to work. And it puts the patient at risk for side effects and extra costs due to unnecessary drug treatment. So the more that you take this drug, the more you become resistant, the more money you're paying out. Antibiotics awareness. Antibiotic-resistant bacteria cannot be fully inhibited or killed by an antibiotic. So therefore, that's what I was saying. When you take antibiotics and you don't need it for like coughs or flus, you become resistant. So therefore, when you do have an antibiotic, it won't kill it if it becomes resistant. They would have to try to find something else, and you have to be on something else for a period of time to see will it work. Don't share your antibiotics. So if you do not take all your antibiotics, if someone else, your friend have just say an infection or something, you don't want to share it, because if you're not taking it all, then you're not killing that infection. Therefore, that strain come back stronger, and you'll need a stronger dose. Don't take medicine that was prescribed for someone else, because you never know. You probably be smaller than the person it was prescribed for. Your kidneys probably not work as best as it should as the person that it was prescribed to. So you don't want to do that. Don't save an antibiotic to use the next time you get sick. Medication does have an expiration date. Complete the prescribed dose of antibiotic therapy, and that's another thing that I was saying. You don't want to not complete it, and that that bacteria come back stronger than what it was the first time when you could have killed it. Antibiotic resistance. Antibiotic resistance is a growing problem, both in the United States and across the world. The main driving factors behind antibiotic resistance are the overuse and misuse of antibiotics. Not completing the prescribed dosage of antibiotic therapy can also result in antibiotic resistance. Antibiotic therapy contributing to antibiotic therapy resistance. In 2014, 266.1 million courses of antibiotics are dispensed to outpatients in U.S. community pharmacies. This equates to more than 5 prescriptions written each year for every 6 people in the United States. That is a lot. At least 30% of antibiotics prescribed in the outpatient setting are unnecessary, meaning that no antibiotic was needed at all. Azithromycin and amoxicillin are among the most commonly prescribed antibiotics. More harm than good. Taking antibiotic increase your risk of getting an antibiotic-resistant infection later. Antibiotic kills the healthy bacteria in the gut, allowing more harmful bacteria such as C. diff to grow in this place. So as you know that you do have good bacteria. You have normal flora that's on your skin that fights off bacteria. So if you kill that, an antibiotic kills bacteria. So if you are taking too much of it, you killing it, you are more prone to a lot more infections, such as C. diff. I see that a lot in the hospitals. You get on a lot of medication. And you have diarrhea, real bad diarrhea. It's important to only take antibiotics for bacterial infections, since they can put you or a child at risk for harmful side effects. And this is the antibiotic safety. It says antibiotics are responsible for at least 1 out of 5 emergency department visits for adverse drug reactions. Antibiotics are the most common cause of emergency department visits. Healthy People 2020 goals. Goals to help bring about a solution to antibiotic resistance. Reduce the number of courses of antibiotics for ear infection for young children. And reduce the number of courses of antibiotics prescribed for the sole diagnosis of the common cold. Question to ask yourself. This graph lists a couple of common problems that we might send us or our loved ones to the clinic for. When going to the clinic to seek medical attention, you should first find out what it is that you're concerned about. And then, is it caused by bacteria or by a virus? Strep throat. Bacteria, so, you would need antibiotics. Whooping cough, it's bacteria, so you would need antibiotics. UTI, urinary tract infection, it's a bacteria, you would need antibiotics. Sinus infections, it could be a bacteria or a viral. You just never know. It can be come from a common cold or anything like that, so you may or may not. You need further tests in order to see that. Middle ear infection, it might be from a bacteria. You have Common colds you won't need, sore throat you won't need, cough you won't need. Antibiotic stewardship, this is what the topic is today. Antibiotic stewardship is the effort to measure and improve how antibiotics are prescribed by clinicians and used by patients. Improving antibiotic prescribing involves implementing effective strategies to modify prescribing practices to align them with evidence-based recommendations for diagnosis and management. In 2014 and 15, respectfully, CDC released the core elements of hospital antibiotic stewardship program and the core elements of antibiotic stewardship for nursing homes. And basically, that's just putting somebody in place in order to stop all the misuse of the antibiotic and to just keep track on it. Antibiotic stewardship program should provide regular updates on antibiotic prescribing, antibiotic resistance, and infectious disease management that address both national and local issues, basically keeping a track on it. There are many options for providing education on antibiotic use, such as dietetic presentation, which is the information now that I'm giving, which can be done in formal or informal setting, messaging through posters and flyers, newsletters, or electronic communication to staff groups. Reviewing de-identified cases with providers where changes in antibiotic therapy can have made is another useful approach. A variety of web-based educational resources are available that can help facilities develop educational content. What is the core element of hospital ABT stewardship program? And this is what it consists of. Leadership commitment, which is dedicating necessary human, financial, information, technology, resources. Accountability. Someone has to be accountable. Appointing a single leader responsible for program outcomes. Experience with successful programs shows that a physician leader is effective because more than anybody, a physician knows who prescribes or what he prescribed it to and for what. Because nurses cannot prescribe medication. Drug expertise. Appoint a single pharmacist leader responsible for working to improve antibiotic use, which is who knows medicine better than a pharmacist who have studied it. Action. Implement at least one recommended action, such as systemic evaluation of ongoing treatment needed after a set period of initial treatment, such as an antibiotic timeout. After 48 hours, should a person still need antibiotic or not? Tracking. Monitoring antibiotic prescribing and resistance patterns. Reporting. Regular reporting information on antibiotic use and resistance to doctors, nurses, and relevant staff. And education. Educating clinicians about resistant and optimal prescriptions. What is the core element for antibiotic stewardship in nursing homes? And basically, it's still the same. The leadership commitment, but it demonstrates support and commitment to safe and appropriate antibiotic use in your facility. And hospitals and the nursing home are different. Hospital, you see people come in with different things. And with the nursing home, you get the same patient, basically with the same disease process, unless something else extra is added, such as a UTI or something like that. Accountability. Identify physician, nursing, and pharmacy leads responsible for promoting and overseeing antibiotic stewardship activities in your facility. So therefore, the accountability will be with the physician, the nursing, and the pharmacy, instead of just one person. Drug expertise. Establish assessment to consulting pharmacists or other individuals with experience or training in antibiotic therapy stewardship for your facility, because they don't have an on-call pharmacy at the nursing home. They use probably the local pharmacy. Action. Implement at least one policy or practice to improve that use, antibiotic use. Tracking. Monitor at least one process measure for antibiotic use and at least one outcome for antibiotic use in your facility. So you need to know if it works, if the outcome works, if the implementation is working. Reporting. Provide regular feedback on antibiotic use and resistance to prescribing clinicians, nursing staff, and other relevant staff. And educate, provide resources to clinicians, nursing staff, residents, families about antibiotic resistance and opportunity for improving antibiotic use. The stewardship in the nursing home, harms for antibiotic overuse is significant for the frail and older adults receiving care in nursing homes. These harms include risk of serious diarrhea, infections such as C. diff, that comes from being colonized or develops infection with antibiotic use. And up to 70% of nursing home residents receive one or more courses of systemic antibiotic in a year. And they do, because they're more susceptible to things, and they feel that they should have more antibiotic. But when you're older, your kidney function kind of decreases as well as some other function. Antibiotics everywhere. Antibiotics are not only limited to nursing home and hospitals, but are being prescribed in dental offices and clinics. So whenever you get a cold, not a cold, but whenever you get an infection such as an ear infection, you do go to the clinic. Most time they have after-hour clinics or 24-hour clinics. Dental office, when you go for a toothache and you have an abscess or something like that, they do give you antibiotics for that. Rather, the patient is being prescribed antibiotics in the hospital or during a dental office visit. Education should be emphasized to the patient about the appropriate antibiotic use and the importance of taking antibiotics exactly as directed. Don't take no more and don't take no less. Take it as directed. Knowledge of antibiotics. Click that link.